Lockdowns in subdivisions, streets, or in houses with clusters of COVID-19 cases. Instead of a province or region-wide restriction, the national government is eyeing to move away from ECQ, MECQ, GCQ to only so-called granular lockdowns.
Ibig sabihin, we give to the community, the authority, to local governments, ano yung areas na kailangang isara dahil mataas ang kaso without having to affect the other areas na merong mabababang kaso.
Health officials say in some towns, COVID-19 cases are only concentrated in a few barangays. With a focused response, they see pocket lockdowns more effective in stopping the virus.
Mas makakagawa ka ng active case finding o kaya nagko-contact tracing kayo ng mas intensive para hindi naman tayo nagsasara ng husto at naapektuhan din po ang mga kababayan natin in terms of their livelihood.
But many ask, is it the right move? People getting sick of COVID-19 have reached an all-time high of over 18,000 a day this past week, and there's no telling when the numbers will stop rising. Hospital beds in 95% of the provinces are near or at capacity. Average deaths in August climbed to 131, second highest since April. And the highly transmissible Delta variant is now in all regions. Health reform advocate Dr. Anthony Liachon and the Octa Research Group, who've been monitoring the pandemic response, say maybe no.
If we shift to a granular lockdown approach, it's not clear if this will cause a downward trend.
I think we should not experiment during this crisis, especially if the numbers are scary to start with.
They say granular lockdowns require more manpower, an additional resource that many local governments can no longer afford. They add effective granular lockdowns need randomized mass testing, contact tracing, and isolation.
If you have a granular lockdown, but you don't have the testing for public people who are mobile, then it may not work as well because sure, na-contain mo yung nasa barangay, but you have people moving around who may be spreading the virus.
I don't know how the government can pull off a granular lockdown na mas lax when we have not been able to do it successfully in the past when the quarantine classification was more rigid.
The Health Department says nothing is final yet. The interagency task force has yet to decide if granular lockdowns could substitute for big lockdowns. Carolyn Bonquin, CNN Philippines.